I'm Doug Klein, a family doctor in Edmonton. I'm broadcasting from my clinic at the MacEwan University Health Center. Really excited to be kicking off this afternoon of ideas. And so, yeah, great to have that discussion. So I'm just going to load up my slides here. Is that need to just share?
Looks great. Perfect. Just expand it. Yeah.
Perfect. Great. Okay. So I'm excited to be here, but I do have the sad news to inform you that we are in a crisis. And this crisis is unprecedented. It is urgent that we act now to change the trajectory of our healthcare system. Now, this doesn't have anything to do with the election last night. It does not have anything to do with COVID. This started well before that. We have a problem. We have a serious problem, is that 15% of Canadians are meeting our physical activity guidelines. Less than half are actually eating the way we were supposed to. 30% of children are overweight or obese. We've got huge issues around screen time, chronic disease, obesity, and mental health are rampant and increasing in our community. And then we add COVID. So in 2020 is that we recorded the lowest level of life satisfaction than that StatsCan has ever been recorded. Certainly eating habits, alcohol use have gotten worse. And if you thought that 15% was bad, is that our youth, and that is correct, less than 1% of youth aged 12 to 17 are actually meeting the 24-hour movement guidelines that we recommend. Adults, the same, decreasing physical activity, increasing sitting time, which we all have experienced with Zoom, and 1 in 5 Canadians reporting high levels of mental distress. Issues around anxiety, depression, and loneliness. Certainly, we've really noticed that through this pandemic. So what have we done? And this is going before COVID. What have we done to do this? Is that we have put much more money into the system. And what we've actually done is, rather than buying healthcare, we've been buying disease care. Now, I'm a family doc. I don't want to treat your blood pressure. I don't want to treat your diabetes, your heart attack, or stroke. What I want to do is I want to connect you with somebody who can teach you how to cross-country ski, be active in the wintertime. Maybe it's learning a new sport, or just something to be active with your family. I want to connect you with a nutritionist who can help you learn new meals, have sort of healthy, nutritious, tasty meals for your family, and help you pass those skills on to your kids. I want you to be able to connect with somebody who can make sure that your mental health is on track and that you have all the supports that you need to be connected and well. So this is a big challenge. Healthcare costs continue to rise. Despite increased spending, people are getting sicker, not healthier. Significant health inequalities exist in our population. We are facing a big issue around specialization of medicine, increased wait times, and decreasing spending on public health and education. We need a movement that actually protects health and improves the health of our community. And there is a solution. We need to build life skills that support lifelong nutrition, active lifestyles, and positive social connections. And I think the family unit is really important. We need to focus on the family and the surrounding communities to support wellness. We need to create we've got silos, we've got healthcare, we've got education, we've got business, and we don't work together. We need to make bridges between these organizations to actually help create a sustainable wellness community in Alberta. We need a provincial innovation hub for the promotion and protection of health. No longer this disease care, but we actually need healthcare. What if families actually spent more time cooking together in the kitchen? Children would actually develop the skills of nutrition and meal preparation. What if rather than running from activity to activity, going from soccer to basketball, what if we actually ended up just spending time together as a family, getting our recommended daily physical activity? What if families spent more time connecting with each other and other families? And what if every community in Alberta could see that its own education, recreation, health, and social assets, what they were, and share them with families? We could help families make healthier choices. So, Change Health Alberta, it's a registered charity that we started back in 2016 to provide opportunities for children and families to build life skills to promote and protect their health. There are 4 areas: nutrition, meal preparation, physical activity and lifelong fitness, mental health and well-being, and those strong social connections that we know are so important. So over the last 5 years, we've done a lot. So we created the Change Adventure Camp, which brought kids in to actually learn meal preparation skills, physical activity, and connecting with nature. We created a Change Health Clinic that we've actually got in 2 that will be launching in a second school in Parkland County. And we created the Change Health Community Program to bring families together to learn these skills. And through my role as a prof at the University of Alberta, we brought in over $2 million in research funding for programs around health promotion and improvement. And just a little plug, I had it in the chat as well, is that we have had our annual fundraiser, which is the Healthy Steps for Change event. It's virtual. Anyone can participate on October 2nd and 3rd. Check out the website for details. So what we propose is the creation of the Change Center, a provincial innovation hub located outside of Edmonton, focusing on this new model of health, working with businesses and education, and involving training, evaluation, and research. How we'll do this is by building multi-partner relationships that authentically bridge perspectives and systems, empower our communities to actually design and facilitate and evaluate the solutions. And these solutions, these co-designed solutions, will be delivered with our community partners. And we'll demonstrate how family medicine can work collaboratively with communities to actually create and protect health rather than just treating disease. And we will move from disease care to health care. So our vision is to be one of Canada's leading health protection and improvement programs. With the partnerships I've mentioned, we will co-design these solutions with our communities and with families around healthy nutrition, active lifestyles, and those positive social connections. So we'll take healthcare, education, businesses, and community. We'll take physical activity, nutrition, mental health, and social connection. And we'll change health. If you want to change health, please join us. Thank you.
Thank you, Dr. Klein, for that that presentation. Just a reminder to folks to put your questions into the chat, and we'll ask them, or you'll be we'll moderate and we'll get you to ask them. Let me start off with a question, Doug. been around the health system long enough. I remember the You're Amazing program, the Healthy You program, and a number of these programs that have been health promotion or activity promotion, participation, if I really want to age myself. How do you see the this team approach working to maybe get beyond the limitations that those programs were able to do? And is your call today for, are you looking for providers? Are you looking for advisors? Are you looking for money? What can the community help you with?
So initially, just your question is that you're right, is that a lot of sort of public health initiatives have had limited impact. I think where we're different is we do sort of take an approach that communities actually come with skills. They come with assets. And working with them to actually create the solutions rather than a lot of these public health programs, which are sort of launched and then sort of passed down onto communities, is that really working at a grassroots level to what their needs are. A community may actually need, it may actually not be a physical activity program. It might be a housing issue. It might be a drug use issue that actually needs to help that community become well. And so really focusing on that grassroots level is where we're different. As far as your second question about what we're looking for, certainly is that we're looking for collaborators. So certainly is that businesses who want to be involved. We're looking for community members who like this idea and know that we do need to change from disease care to healthcare. Certainly is that nothing happens without funding. So certainly is we would like some funding, and to, if there are people who are interested in supporting the Change Center, that would be great. And really is that I think this is not something, and as one of the colleagues is, this is work that isn't going to happen by an individual or a single organization. We do need to collaborate to make this happen.
Okay, thanks for that. Michael, do you want to unmute and ask your question?
Sure, Doug, great presentation and very heartfelt. And I think we'd all like to contribute somehow, but to make this sustainable and scalable to, let's say, Alberta or beyond, how is this going to be paid for? In the end, it's the family, the child, maybe the education system, the healthcare system, many levels that could possibly pay and benefit. But how do you see all that working together so that it really is sustainable?
So give you an example is that the way we're doing, and one of the examples I gave is the Change Health Clinic in schools, is that, so Thursdays is that I actually go out to a high school in Stony Plain, and with the collaboration between healthcare and education, we can actually do way better with our existing resources. There's no additional money that's actually required, is that, and part of it is influencing that students actually get an education that's going to set them up for a lifetime. And that requires things around sort of physical activity, learning meal preparation skills, those types of things. So it is something that isn't necessarily, oh, well, we need to fund more programs. It's actually helping these sectors work together to achieve those common goals that we have.
Thank you.
Thanks, Michael. Nikhil, it's more of a comment than a question, but do you want to introduce what the USeed Investment Fund?
Yeah, for sure. Hi, Doug. We at Innovate Calgary, we have a social impact fund through which we invest into not-for-profits and for-profit organizations that are geared towards creating a positive impact in our community. So definitely I've put the link in the chat below. So if you want to check that out, or even if you want to have a conversation, happy to connect. But definitely really great initiative you're leading there.
Thank you. I definitely will check it out.
Excellent. So just to try to stay on time, I'd just like to thank you, Dr. Klein, for your presentation. I've got a comment I'm going to send. I'll put it in the chat for you. and we'll move on to the next presentation. But thank you for your time today.
Thank you.